We're at the 25th CROI. We're here with Keri Althoff from Johns Hopkins University, and we really appreciate you taking the time. And you're talking about, at this conference, about longevity, and right. Set us up on that one.
So at this conference, I'll be presenting some estimates of life expectancy among adults with HIV, and I look in a subgroup of individuals who initiated ART at a higher CD4 count, so 350 or above. And we're just looking to see at what the changes in life expectancy might look like. I'm most interested in disparities amongst key populations, so looking in black and white MSM, black and white women, so it's not just big brush strokes anymore, let's get into these subgroups that need some additional resources and attention to ensure that their health is being protected as is others. So that's where I'm going with it. You know, life expectancy is an important indicator in public health. It tells us a lot about the health of a population. But the more I work with it, the more I wonder about it in the context of HIV. We have people who are living longer, right? So we have a longer lifespan. But it's no longer the lifespan that I'm so interested in. It's the health span. So the amount of healthy time someone is spending in their life. And I think, you know, you could say, well, there's an HIV infection, so that already reduces health span. But we know that there's a lot that still can be lived and healthy life years that are available to individuals with HIV when we initiate treatment at high CD4 counts and get people into regular care and avoid other comorbidities. So it's really drilling down now to look a little bit deeper at what are some risk factors that we see, particularly in early and midlife, that we could potentially intervene upon to preserve and elongate the health span and kind of start to maybe not so much pay attention to that lifespan as much anymore.
The people in the early days, much like myself, we went through hell, you know, and it was because of the drugs and the disease. And we didn't have effective drugs. We had to keep switching because of the resistance and so forth. And so our lives went from pretty miserable to where we're, you know, healthy people again. So we've now evolved to a health span. But what you're trying to do is begin with that rather than wait till people get sick.
That's right.
And to do that, we have to make sure people are tested, because if they don't know they're positive. The biggest thing we ran into in Florida, where I lived for a number of years, was there was a lot of bedroom communities where a lot of women were just, you know, moms and, you know, in the country area, and they didn't know they were positive. And the way they found out was when they were opportunistic infections popped up.
Right.
They weren't in a risk category.
Right.
So that's another big challenge. Like you were saying, you're looking at those populations.
That's right.
Specific. So that should tease out some more information.
So I think you're hitting on a really important subgroup, right? So we have populations that we know are at higher risk, and we're really targeting test and treat there. I keep hearing more and more stories about older adults being diagnosed with HIV after sometimes a 2-year kind of wild goose chase for why are all these strange things happening, right? And then at that point, they're far enough along in disease progression that we missed our opportunity to get them tested and treated. So, you know, it's a lot of different factors that play into that. I think, you know, not recognizing someone as a high-risk person and therefore not getting an HIV test, not thinking to order that, it's something that I think, you know, even clinicians with the best of intentions, some of the best clinicians, it may just not be in their differential. So it's kind of opening all of our minds to the idea that HIV infection can happen anywhere, anytime. So we really have to think more broadly in order to be sure that we are testing everyone and getting people into treatment as soon as possible.
I think it might not be a bad idea to do more. I mean, I guess we had President Obama was tested, and you know, very, 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 very low risk. I mean, you don't know, but you know, you still, it's just important to just be practical and just do it.
Yeah, and I think, well, we have to balance. Everything's a balance, right? And one of the things that gets a little tricky in low-risk populations is we get a higher rate of false positives on the tests. And so we do have to be careful about that, and we have to have careful analyses to weigh that risk when we're talking about looking at testing, you know, every single person.
But you confirm.
That's correct, and then we can confirm. But there's still, you know, a lot of emotional roller coaster that comes with that. So everything's a balance, but I think if anybody even has an inkling that they could be at risk for any reason, getting tested.
So we don't put it just on the doctors, although we should on them, but also on the patients to understand what symptomology is like. And like you say, there's a differential that you kind of look through, but it's not in there. It's not, doctors really don't think about it.
I think the thing that comes back, a kind of a theme that I see, and it's not just within HIV, it's within any disease context. People have to be empowered, right?
Yes.
You have to take control of your health,
Right.
and health seeking to get the tests that you believe are needed. And I will say that's easier said than done for even people with the greatest amount of resources, let alone somebody who may not have access. So it's a challenge. It's a challenge.
We do a lot of local television shows, and we've always done, almost every year, a show on when do I call the doctor, and then when do I call another doctor.
Yeah.
You know, because you don't want to, the doctor has been, maybe your doctor forever since you were a kid, and you don't like to say, are you sure you're doing the right thing? But it's doctors are humans, and I don't mean to disparage them in any way, but a second opinion is worthy if you think so, if you think it is, and if you don't feel good, you shouldn't mind going back again to get another opinion. Say, I just think there's something going on here.
Right.
And like you said, the HIV presents itself in many different forms, and usually opportunistic infections if it's late in, if you're in the case of like what we call AIDS. Is it still under 200 T cells, or do we?
There's a whole list of opportunistic infections as well, and I think we see those more. But yes, CD4 less than 200 is also
classically,
part of that definition.
but the thing is, you can have all kinds of skin diseases that show up, and they don't. That's not the first thing they're going to think of, like impetigo or something like that. Usually, things that when your immune system goes and crashes, and like say gets under 200, you should be thinking. Well, you don't know, but it could be almost anything that would pop up that you've been exposed to that will then rear its ugly head acutely.
That's right.
And you're now dealing with a symptom of HIV.
That's right. So. And even before that point, if there's any risk factor that you could think of, including whether or not your partner has engaged in risk behavior.
From a practical standpoint, you just have to know.
You just have to get yourself tested.
And you have to be honest and discuss these things with your partner. It may be hard to do it. It may be painful, but it's important for both of your health.
That's right. Yeah. And I think this empowerment is ringing true in another campaign that I think has just, it came from the community and it's so powerful. It's the U equals U movement. And, that is a complete and total, retaking of the power of controlling your own health and getting undetectable and living the life that you want to as an undetectable person. And I think those movements and that it's so powerful and it's so important, right? Because in the end, it's the person who is caring for themselves, and I think that's key.
Taking ownership of what you are living with.
Yes. Yes.
Well, I appreciate you taking the time with us so
of
much.
Course.
This has been always a nice talk and very practical approaches to things, and it's important to do that every single day.
Can I make two more comments about the conference this year? So I think there are two more things that have to be pointed out that I am so thrilled to talk to you about. Okay. The first thing is that the kind of women's movement is here, right? Yeah. So this is the first CROI where half the presenters are women. Yeah. Some of the big findings are among women, looking at the increased risk of HIV infection in pregnancy and postpartum is one of the big stories coming out of this meeting, which interestingly, the woman who is the first author on that, she is at home right now with her 5-week-old twins. And all I could think when the presenting author said that was, Can you imagine being pregnant with twins and analyzing this data about HIV infection risk while pregnant with twins? I mean, representation matters.
It does.
And I just think that's such a powerful example of that. And congratulations to her and her new babies.
Yeah.
The other thing that I think has really been important in this conference is a focus on mental health.
Yeah.
And this
Yes,
is,
I was just talking to Carl about that.
oh, it's so key. It's so key.
It's with the gun violence. It's brought it home, and it's bringing it home with the issues of trying to get people treated that are not in a position to be treated, adequately or appropriately or emotionally or whatever it might be, or psychologically.
That's right.
There's huge challenges there, and we have to address it as a nation. We have to address it as a global effort.
We do. We do. And, it goes, from the big scope down to the grassroots into the big scope again within our research even. I mean, making sure that we have measurements of mental health in outcomes of physical comorbidities is really, really important. These things play together. And in a talk that I'm giving this afternoon, I talk a lot about, the mental health components and aspects over the course of a lifespan. The plenary this morning made the important point that we need to constantly be screening and evaluating because things happen in life, things change, and knowing about your own mental health status and working with your clinician to get the treatment that's needed is important. And it plays into other risk factors. Smoking is really hard to quit if you don't have your depression fully managed otherwise without the nicotine.
I usually ask that from people. I think it's important for them to understand where they are psychologically and the stress that's going down today with everything political and everything emotionally and the gun violence, and you just add it all up. It's additive, or it might be, synergistic. I don't know.
That's right.
This is, I can't.
That's
we were just
right.
talking about people running down the street, and now we want to arm teachers in schools. I don't want to get political or anything, but this is like,
it's a lot.
I'm waiting for those awful moments that are going to happen.
It's a lot.
So we really have to really address these, and I really appreciate you bringing that up. By the way, I also think that men should be more supportive. Well, not that I'm saying that they aren't, but I mean they should be more engaged in the Me Too movement, and just like I always complained about the breast cancer movement, men can get breast cancer.
That's right.
But by the same token, they should just be supportive of the whole
That's
movement.
right.
It was almost exclusive for women, and I think, no, bring the men in.
That's right.
It's about women, it's not just for women.
That's right.
Because we're all involved in this whole issue.
That's right. And a movement is not just about the people that the movement is for.
It's
right?
not
A movement
everyone
is
that
for
supports
everyone.
it. Yep.
It's for everyone.
We all support it.
Yeah. And I will say I had a great conversation with one of my male colleagues here who was so inspired by the women empowerment here at that conference, focusing on women with HIV, focusing on women in STEM, focusing on, women. And it's great to see that involvement from the whole community. It's not just women in this movement. It's really everyone here at this conference, which I'm so happy and so thrilled to see happen.
And I don't think we had to try, not me, but the conference had to try hard to, make it sure that we're 50 and 50, And it really shouldn't have to be that, because I think it could be 75% women giving the you know what I mean? There's no reason. There's women, it just happens in science. It's not.
When you see the proportion of female graduates from undergraduate and medical degrees, the wave of the future, I mean, those numbers are compelling. It's more women. So,
so there could be 75% women. It's not a problem.
We'll see.
I think it's important, and the mentorship is important too. I work with a lot of the young investigator discussions here, and we do find that a lot of the women are, much more practically able to deal with all this stuff. It's a lot of stuff you have to go through, and you absolutely have to have a mentor.
Absolutely. And I mean, this conference, one of the lead organizers, Dr. Judith Courier, I mean, what a role model.
She was the one that every year, because I talk with her about it specifically, she always thanks me so much for doing the work that we do with the young investigators, talking with them here. Because it's the future. Yeah. Look how many of the people that started this with AIDS are literally beyond their retirement years.
Oh, yes.
Which is I am. I'm 72 this year.
Congratulations.
Yeah, so I'm like over the hill and still here.
And we're happy you are.
I talked with Kathy Squires, who's now with Merck, and she said, are you still doing this? I said, yes, I am. You know, she's a real champion of the old days. But, you know, you see more and more of them are either retiring, going into industry or whatever, but all appropriate. They're all doing good work wherever they might be.
They are.
Yeah. Thank you so much, Keri.
It's
I
great to
appreciate
see you,
it.
Fred.
Yep. Good to see you.